Well, it's 12:03, which is our appointed start time. I'm sure more folks will join as we get going. Thank you for being here with us today. For those of you I haven't met, I'm Aimee Lewis. I am the Chief Development Officer and Vice President of External Affairs here at Planned Parenthood of Tennessee and North Mississippi. And it is my pleasure to welcome you today for our annual talk. You're going to get to hear a lot about the great things we've done over the past year and the challenges we're facing and all the work you're helping make possible through your activism and your gifts. And you're going to hear directly from our fabulous CEO, Ashley Coffield, our medical director, Dr. Rosalyn Porter, our senior manager of education, Victoria Freeland, and our director of advocacy and organizing on our C3 side, and executive director of Tennessee Advocates for Planned Parenthood on our C4 side, Francie Hunt. We will have a few minutes at the end of everyone's remarks for some Q&A, so please be sure that you are lifting that up in the Q&A function on the screen so we can answer all of your burning questions if we have time. All right, thanks everybody. I'm going to turn it over now to Ashley.
Thank you so much, Aimee, and thanks everybody for being here today. It really lifts my spirits to have you with us, that you care enough to spend your valuable time with us. Planned Parenthood represents a very specific type of freedom in our country, the freedom to fully know, love, and control your own body no matter what. So it makes sense that for decades, Planned Parenthood of Tennessee and North Mississippi has been vilified and perennially targeted as something to defund, shut down, or silence by those who seek to control others and weaponize shame and stigma. Thanks to your support and generations of supporters before you, we prove year after year that we're not going anywhere. Right now, we're weathering the most massive wave of defunding in our affiliate's history, with millions of crucial federal dollars lost due to sweeping cuts to Medicaid, HIV prevention, and Title X. While we pivot and adapt in real time to minimize the long-term effects of this defunding, this financial loss is already affecting our ability to provide our patients the care that they need when and where they need it most. The defunding you've probably heard about the most in the news is the removal of Planned Parenthood affiliates nationwide from state Medicaid programs, which happened when the president signed the big ugly bill in July. This hits our affiliate hardest in Memphis, where 25% of our patients use Medicaid. This compares to about 10 to 15% of our patients in Nashville and Knoxville. We have challenged the defund in federal court, and we hope to have some answers from the First Circuit Court of Appeals sometime soon. In the meantime, no Planned Parenthood affiliate can accept Medicaid from a patient and bill for services provided, like for cancer screenings, STI testing and treatment, and birth control. In September, we made the difficult decision to temporarily close one of our 2 health centers in Memphis while we explore the most cost-effective way to deliver affordable, high-quality care in the Memphis region while the defund from Medicaid is still in effect. For us in our hostile political climate that we're in here, we have to also think about and accept the possibility that for us, this defunding could be permanent. In response, we have adjusted our patient pricing structures, keeping services as affordable and low cost as possible for those who don't have any insurance or can't use their insurance with us. We've also implemented an expanded patient assistance program for those patients who need it, which includes free services for patients 18 and under. This past summer, we launched the Pink Horizon Listening Tour, focused on hearing from you, our supporters and allies, as we face this moment of profound change and transformation. We called it Pink Horizon because we like to call things pink and label things pink, but it's also because we believe that a new day is coming, one that is shaped by the voices of the people that we serve. To date, I've visited 12 communities and spoken to more than 400 people in East Tennessee, Middle Tennessee, and North Mississippi. I look forward to visiting West Tennessee this winter, and I want to give you some highlights of what we've heard so far. Many of you shared similar feelings about the state of reproductive health care and our current political environment. Folks across our state feel anxious, angry, frustrated, and disenchanted. In Oak Ridge, one person told me he feels like he's in the back seat of a car with a drunk driver at the wheel and he can't escape. At the same time, many of you identified Planned Parenthood as a provider of not only healthcare services, but of hope, safety, and truth. Notably, you name Planned Parenthood as a source of community. You value us as a lifeline for those without access to care, a hub for organizing and education, and a beacon of hope offering confidential, affordable healthcare. You want to see an expansion of services, especially healthcare services in rural areas, more education and outreach, and the restoration of our autonomy and reproductive rights. I do too. Your feedback aligns with our goal to fortify Planned Parenthood as a community for all of our activists, neighbors, patients, supporters, donors, and more. At our core, and in each action we take, we want to provide care for everybody in all of the various forms that can take. Through your engagement with us during our listening tour, I feel ready for a new day and can sense that you do as well. I believe a pink horizon is dawning, and with it a better Tennessee and Mississippi, in which we are able to secure a future shaped by our voices and our communities. Thank you for helping us adapt and rise toward a new future that's rooted in justice, resilience, and bodily autonomy. And now I'm going to turn it over to our medical director, Dr. Rosalyn Porter, to center us on the valuable patient care that we've provided so far in 2025. Rosalyn?
Thank you, Ashley. This year, we served nearly 15,000 patients in our health centers and via our telehealth visits. Our health center teams provided services ranging from annual exams with PAPP tests and breast exams for cancer screenings to all forms of contraception, STI testing, vasectomies, PEP and PrEP visits for HIV treatment, problem visits, and more. Our free app, PP Direct, is live in both Tennessee and Mississippi, providing access to home-delivered birth control, emergency contraception, and UTI treatments for patients in rural areas with few to no healthcare options. Through PP Direct and telehealth visits, we provided over 4,200 people in 419 zip codes birth control, emergency contraception, and gender-affirming care. In fiscal year 2025, we were able to date more than 435 pregnancies, providing patients with the information and support needed to decide their futures. Since July in 2024, we navigated 780 patients out of state for abortion care and provided over $160,000 in financial assistance. Since we lost abortion 3 years ago, our patient navigator has found that patients who need our help traveling out of state have the most barriers, with little or no access to transportation, internet to arrange travel or hotels, or childcare. When our navigator tells patients that PPTNM can help with travel, food, lodging, and childcare, they oftentimes get silent in shock, begin to cry, and some will even ask, "Is this for real?" One of our navigation patients recently wrote, "Thank you, thank you, thank you. I've been stressing out about this so much and praying for a miracle, and you answered that. Thank you again." Bodily autonomy is fundamental to Planned Parenthood's values, and we are excited that our vasectomy program continues to grow. We've found that our standard of affordable, non-judgmental healthcare for all ages and demographics is valued just as much by men as women, because it's not only women who are told to wait until they're older, wiser, or have children before choosing permanent birth control. In 2026, to expand the continuum of care for our patients and meet them at every stage of our lives, we are adding new service lines, including perimenopause and menopausal care. We're exploring adding more services to our telehealth model as well. As rural hospitals continue to close, affordable telehealth options are especially important for reaching patients with few to no healthcare options. Next up is Senior Education Manager, Victoria Freeland.
Thanks, Dr. Porter. Hi, everyone. So this year, our education team delivered some of the most innovative and far-reaching work to date. Our education sessions reached 1,766 participants across nearly 180 zip codes in 19 different states, with a total of 540 total hours of education delivered across Nashville, Memphis, Knoxville through virtual programming, Spanish language instruction, plus another 106 hours of professional training. That's an 89% increase from last year. We also trained 31 new certified HIV testers, 30 college wellness advocates, 42 askable adults, and engaged with 20 young peer leaders through our newly redesigned Tennessee Youth Advisory Board. This year, we've significantly expanded our education reach by developing and adapting programming for individuals with intellectual and developmental disabilities, people in drug recovery, and incarcerated or justice-involved youth and adults. These new focus areas allow us to bring comprehensive, accessible, and equity-centered education to communities that have been historically underserved. This year, as a part of a push towards innovative programming, the education team finalized the Healthy Sexuality While in Recovery curriculum. What started as a pilot in East Tennessee has now expanded to 8, I think 9 now, recovery facilities across East and Middle Tennessee, and it's already making a real difference. One participant shared with us, "Being intimate with my girlfriend again has been really hard now that I'm sober. We used to be hook up after using drugs, and my body just doesn't respond the same way. I even thought I might start using drugs again. But after your lessons, learning how drugs affect my body during sex, exploring new ways to have those experiences sober, and how to talk with my girlfriend, I'm feeling hopeful again." This kind of feedback shows exactly why this program matters. It's helping people rebuild their lives and relationships while in recovery. We're looking forward to be able to expand this programming into 2026. Our condom access initiatives expanded dramatically, with Free Condoms Tennessee reaching individuals in Tennessee, Mississippi, and Arkansas across 452 zip codes. This resulted in the distribution of a whopping 2.5 million safer sex supplies. We also supported 210 community partners through our bulk outreach distribution and saw around 10,000 website visits, including 800 from Mississippi. This distribution effort, I want to make very clear, would not be possible without all of the staff and volunteers who packed and sorted so many condoms this year. Although we unfortunately lost federal funding for condom distribution this year, our team has remained committed to meeting community needs by filling smaller orders whenever possible, and linking organizations directly with alternative distribution partners to make sure that they have continued access. This year, we began expanding our virtual education programs through our Askable Adult training series. We also had our adolescent sex education program called the Autonomy Project. Building on that momentum, we're continuing to grow our virtual portfolio with the long-term goal of launching a virtual school, which is an asynchronous education library that will help provide folks from across the region with access to quality and high-quality sex education and opportunities to become peer educators. This expansion will also include Spanish bilingual education, professional trainings, and additional ways for parents and caregivers to become askable adults. Our department puts a lot of effort into providing comprehensive, age-appropriate sex education to people of all ages in our communities. So before I wrap up, I want to share with you some of our anonymous questions that we have gotten from our in-person youth education sessions this year. These quite literally come to us on note cards and are written out. So I'll share a couple of these. How are babies made? Do people have to use condoms for the rest of their lives? Do periods make us angry? How do I know if I'm a virgin or not? Can you get pregnant after you have your uterus removed? Why do we feel the need to have sex? And you can hear I'm out of high school right now in the background. If any of those questions spark a valid question moment for you or I never thought of that reaction, it really highlights the curiosity and the real concerns that people bring to our programs. And it shows why supporting comprehensive sex education is so incredibly essential. Thank you for everyone for supporting all of our work that we do across the state. And I would love to introduce Francie Hunt, who is our Executive Director of the Tennessee Advocates for Planned Parenthood and the Tennessee Advocacy and Organizing Director.
Thank you, Victoria. That was a great overview. I'm excited to hear all the work that you're doing. In our Organizing and Advocacy Department, we've spent 2025 leaning into grassroots power building. Grassroots organizing and power building is the deliberate relational work of making enough critical connections to hold our community together through all of these attacks, opportunities, and transformation and action. We've been building power in communities across our region through action councils and a brand new initiative called Impact Circles. Our 13 action councils are local networks of dedicated community volunteers who work year-round to organize, strategize, and drive sustained change in their communities. And I'm thrilled to say that we have 8 new action councils in 2025. Our new initiative, Impact Circles, are groups volunteering to host 2 events per year and build leadership skills as they grow a strong network of reproductive rights advocates in their communities. We've already had 8 across our region. We work to recruit and ensure that pro-reproductive rights champions run for office in key races in 2026. This effort is called the Pipeline Project, where we launched campaign crash courses to grow networks of effective campaign teams across Tennessee by developing candidates, campaign managers, staffers, and field organizers. We've held campaign crash courses in Memphis, Nashville, Murfreesboro, and Knoxville, and plan to hold one in Chattanooga in early 2026. So hold the date for the January 16th weekend. Each crash course includes 8 intensive training sessions, plus a real-world campaign planning scenario and presenting session, which are really fun. Last year, over 500 advocates attended educational legislative advocacy events, including field trips to the Capitol, legislative education webinars, and our annual Day on the Hill, where supporters learned more about Tennessee state government and how it works, met with our legislators, and toured the Capitol and the Cordell Hull building. Our brand new field trips to the Capitol, led by our legislative lead, Isabella Bartolucci, helped remove fear from participating as a constituent and legislative process and encouraged our civic education among our reproductive rights base. Now, before I put my 501c4 Tennessee Advocates for Planned Parenthood hat on, I would be remiss if I also didn't name that our college-aged Generation Action activists expanded into 3 new Tennessee campuses at Fisk University, Meharry Medical College, and Maryville College. And we've added 200 new engaged young volunteers this past year, which is really exciting. So just to be clear, I'm going to put, for legal purposes, my 501c4 TAPP hat on right now. I want to talk about the unexpected opportunity we had this fall when Congressional Representative Mark Green announced his resignation from the Federal House of Representatives over the summer. TAPP immediately sprang into action, holding candidate forums and leading Get Out the Vote efforts. After Representative Afton Bain was nominated as the Democratic nominee, we began working on behalf of Planned Parenthood Votes, our National Political Action Committee. Planned Parenthood Votes drives pro-reproductive rights through turning out to our weekly phone banks, our door knocking, and organizing hundreds of volunteers for the election that happened this past Tuesday on December the 2nd. With help from the amazing work from Melissa Sauter, our campaign field division head, Tuesday's results in Tennessee were something to celebrate. We saw results in Tennessee's 7th congressional district, where we were able to prove that even in districts that typically vote for Republicans by large margins, voters are fighting back against the policies of the Trump administration and the Republican majority in Congress. Afton Bain made historic inroads in this election, mobilizing voters across the district and turning what everyone predicted to be an easy Republican win into a highly competitive race. The lesson from Afton's campaign is clear. Voters are looking for leaders who will put healthcare affordability and private medical decisions over billionaire special interests. During the general election alone, our people-powered coalition knocked door-to-door over 106,000 voters and made over 226,000 calls to voters in Montgomery and Davidson counties. And that fueled a surge in turnout that fundamentally shifted the race. Afton's near upset is a clear message. Tennesseans want a champion who fights for our freedoms, our families, and our future. Our supporters made tens of thousands of calls because they know that reproductive freedom is on the line. Today, their work paid off, we saw this past week, and this surge shows that voters are already ready making change. As your certified hope dealer, I'm extremely hopeful as we look to the 2026 midterm elections. The grassroots power building that we've invested in the past year has the potential to help our coalition flip seats to regain power and ultimately our reproductive freedom in Tennessee. I think Ashley has a final few words before we answer some questions, so I'll turn it over to her. Thank you.
Thanks so much, Francie, and congratulations for everything that you and the advocacy and organizing team have accomplished. It's pretty incredible. I want to close by saying that PPTNM continues to exist because of your unwavering trust and belief in our mission to provide high quality, equitable reproductive and sexual health care. As we move into 2026, executing that mission has never been more important or more difficult. Every action that PPTNM takes and every action that TAPP takes are steps toward liberation, and every step matters. To save our region and our country, we need safe spaces for healthcare, consistent and diligent organizing, and multi-pronged educational and training opportunities. The work ahead requires all of us. Here's how you can help. Donate. Your contributions at any level help fund our patient care, community programs, and advocacy. Become a patient. Your private insurance or your self-pay dollars are great sources of revenue. Use our PP Direct app for birth control, emergency contraception, and UTI treatment. Share it with your network. Start an action council or impact circle to activate your network around access to reproductive health care. Connect our educators to local community groups to expand access to accurate, age-appropriate sex education in your area. With you by our side on the front lines, no matter if it's literally or figuratively, we can continue to defend the defenseless, win back the freedoms we've lost, and ensure healthcare access for thousands in our region. Thank you for standing with us as we continue to provide care for everybody across Tennessee and North Mississippi. Thank you.
Thank you, Ashley, and to you, Dr. Porter, to you, Francie, and Victoria as well. Appreciate your updates and your inspiring words. Okay, so got a question to kick off our Q&A, but please remember you're welcome to drop them in the Q&A if something comes to you. We're happy to answer the questions you have. I'm going to put this one to Francie. What do you anticipate in the legislative cycle? What's the next attack?
I mean, we always would raise up birth control. We always knew that it wasn't just abortion they're after full control over our lives. And probably the best next step would be attacks in some form or fashion on birth control. We already saw this past year that Tennessee Right to Life was extremely unhappy with Governor Bill Lee signing IVF protections. So they've been out there saying that they're going to be relentless on trying to peel back access to IVF. So we can imagine more attacks like that. We won this year as part of a coalition of Education for All, ensuring protections for immigrant families to be able to continue to send their children to public schools. And although we won this year, I expect that we're going to see more attacks in that vein this legislative cycle. So everyone's continued to support at the legislature, helping raise awareness and helping connect the dots for people. Will be immensely helpful. So, definitely mark your calendars to attend our Advocacy Day in March. and participate in local ways that we can help educate the base in each of your areas on the legislative cycle, which we'll have a better idea as early as January what some of those bills are that we're going to be monitoring. But you can use this as a source of information for that.
Yeah, and I'll add how important our trips to the Capitol are for people who are new to these issues. It really helps open their eyes to what we're up against, and it really helps build skills in terms of using your own voice when you are having a conversation with the legislator. So we encourage y'all to bring your friends. It has a profound impact on people and their activism.
And a follow-up to that, somebody asked, how can we arrange carpools to the field trip to the Capitol?
Love it.
Yeah. You can email us at PPTNM. We'll let you know the time, date, logistics for it, and we'll make sure to connect people in your area to drivers so that they can all attend together. I love that. Thank you for asking that question.
Yeah, and Francie, you broke up just a little bit at the beginning, and so Francie was saying email advocacy@pptnm.org. So there you go. Okay, let's see. This one, I guess, would be a good Ashley, Dr. Porter question. Have you seen patient numbers decrease?
We stopped seeing Medicaid patients. We were required to in September. That the bill was signed in July, but there was an initial injunction on the bill and Planned Parenthood's participation in Medicaid that was lifted by a judge in September. And since September, we have seen our numbers go down, and they track pretty consistently with our Medicaid population. We're doing everything that we can to get them to be able to afford our care. But we can't, as an affiliate, afford to provide everything as if they did have insurance. So we're hoping we can get those patients back. We're doing everything that we can, but yes, the numbers are down.
Okay, and here's another one that I think is a good Ashley, Dr. Porter question. And somebody might have to clear up a little bit because I'm not 100% sure what's being asked. The question is, Tennessee has a high Black maternal mortality and infant mortality rate. How can citizens like me be on these boards and provide assistance to the community? You may know what boards they're talking about in the medical world, and I don't. So
It may be the state mortality, the state maternal mortality group. Rosalyn, do you want to talk about ways that people can get involved in this issue? Do you have any thoughts?
Definitely that state mortality board is a good one to do some research on and, see if you can get involved. Definitely just making sure, just donating to organizations like this one and, keeping yourself informed about what's going on, talking to your state legislators, and those are the big ways.
Yeah, thanks, Rosalyn. I think that we are in a maternal health crisis in Tennessee, and we're not talking about that enough. Thank you for asking.
Follow-up for Francie. Somebody asked when the Advocacy Day in March is.
I will look that up and answer the question. I feel like it's March 23rd. But on the maternal health, somebody asked a question about what our legislative agenda might be or what attacks might we expect. But we are wanting to do some more proactive, positive bills to move towards helping protect, pregnant people in the state. So thank you, Amelia. March 24th. Is the Advocacy Day. So make sure to save that. But this will be an opportunity for us to educate people about the state of maternal health in Tennessee and the kinds of protections that we can move towards from a policy standpoint to support that base.
Thanks for that, Francie. All right, the final question. I heard there's a protest tomorrow. Are you still open? Ashley, would you like to speak to that?
Yeah, there's a protest that we know about that will be in Memphis, and we will be open. We don't close in the face of protests. That would be a win for them, and it would encourage them to come back. So we always stand up to people who don't want us to exist. We have a plan in place with volunteers and staff, and we've been in contact with law enforcement.
Thank you. All right, everybody. Thanks so much for joining us today and for joining us virtually every day by supporting us, by showing up, by going to the legislature, by calling your elected officials, by connecting Victoria or one of our educators with your friendly PTA group or your mom's group or whoever it is. We could not move the work forward the way we do without all of you. So I loved at the beginning when Ashley was talking about how you have expressed in our Pink Horizon listening tours that you see Planned Parenthood as a community because we do too. We can't do this by ourselves or in a vacuum. It only happens with the people power of all of us combined. So thank you for being with us and for making sure that we're going to take care of everybody. I hope y'all enjoy the holidays.
Thank you. Happy holidays, everybody. Thank you so much.